I'm Sarah Almacian, and I'm the Associate Director of Alumni Engagement and Participation at the UIC College of Nursing. I'm joined by my colleague and counterpart in the College of Applied Health Sciences, KIRSTEN STRAUGHAN. We're pleased you could join us for today's event. Just wanted to share a few housekeeping notes before we start, since this is a virtual format. Today's session is being recorded. All of our participant mics will be muted during the presentation. Feel free to turn your video on or off, however you feel more comfortable. Feel free to use the reaction buttons if something kind of inspires you during the presentations. The chat function is open for you to message one another directly, or you can ask questions of our presenters by sending a chat to everyone. KIRSTEN and I will field all those questions in the chat, and we will then share those with the presenters, so no one has to worry about any of that piece. So today we're fortunate to have 3 faculty members here to present. KIRSTEN STRAUGHAN is a clinical assistant professor and program director in kinesiology and nutrition at the UIC College of Applied Health Sciences. Her teaching focuses on preconception, pregnancy, and breastfeeding nutrition, as well as sports nutrition and health counseling. A registered dietitian since 1998, including 5 years of clinical practice and 7 years of private practice in nutritional counseling work, KIRSTEN had regular appearances on NBC Chicago's Morning News Fitness segment, and also co-authored a book titled Lean Mom, Fit Family. I'm sure I've seen probably one of those segments in the past, KIRSTEN. Our second presenter is RENEA LYLES. As Chef RENEA, as she is known, began her career in the Chicago restaurant scene, having graduated from Le Cordon Bleu Culinary School in '09. Growing up in a family of farmers, RENEA is passionate about growing her own food and preparing it in delicious and healthy ways. RENEA currently manages the UIC Nutrition Teaching Garden while teaching nutrition-focused cooking courses in the Department of Kinesiology and Nutrition at UIC. That teaching garden, fun fact, is actually a very short walking distance from the College of Nursing, and it's behind the College of Applied Health Sciences. I never knew that, so I will definitely have to go and visit that. Our third presenter today is Dr. Mary DAWN KOENIG. Mary DAWN is a certified nurse midwife and associate professor at the UIC College of Nursing, teaching both undergrad and graduate courses, as well as mentoring students. Funded by multiple grants, Mary DAWN's research focuses on how inflammation, the iron regulatory hormone hepcidin, and genetic factors in the placenta determine the flow of iron in both mother and baby during pregnancy. Let's all give a nice welcome to today's presenters.
Would you like me to get started, Sarah?
Please do. Yep.
Okay, well, I will be kicking off our presentation today by discussing the importance of iron on maternal and fetal outcomes and the factors that affect compliance with maternal iron supplementation, as well as the risks associated with high-dose iron supplementation. Iron is one of the nutrients that is critical to a healthy pregnancy. There is an increase in the RDA from 18 milligrams for premenopausal women to 27 milligrams for pregnancy. During pregnancy, plasma volume increases to deliver nutrients and oxygen to the developing fetus and to support maternal needs. This accounts for about a 25% increase in cardiac output. Mom's body does make adaptations to conserve iron during pregnancy through the cessation of menstruation, increases in iron absorption, and mobilizing iron from storage sites. Despite these accommodations, iron deficiency is the most common nutrient deficiency worldwide. And Sarah, you can catch up to slide 4 now. Thank you. Depending on location, between 12 and 40% of women start pregnancy with low iron stores, which then translates to a higher percentage experiencing low iron during pregnancy as iron needs increase. Additionally, Hispanic and Black moms are 2 to 3 times more likely to develop anemia than white or Asian women. Next slide, please. Let's talk more about the risk factors that are associated with iron deficiency for both moms and their children. So iron, of course, is responsible for delivering oxygen to tissues. And when we have a decreased delivery of oxygen, it can result in symptoms of weakness, fatigue, short attention span, poor appetite, increased susceptibility to infection, and postpartum depression. In the fetus, inadequate delivery of oxygen will result in intrauterine growth retardation. Basically, the fetus will not grow to its full capacity. This in turn can increase the possibility of preterm delivery and low birth weight infants, which can increase risk for infant mortality. And it's also related to lower scores on intelligence, language, gross motor, and attention tests. Maternal deaths can result from circumstances where severe anemia will worsen outcomes in situations such as postpartum hemorrhage, antenatal sepsis, shock, admission to intensive care, or severe acidosis. Let's dive a little more deeper into the stages of iron deficiency. So iron deficiency in general describes not having enough stored iron in your body. Anemia refers to a low hemoglobin level, which is the protein in your blood that contains most of your body's iron and carries oxygen. Iron deficiency anemia refers specifically to anemia that is caused directly as a result of low iron body stores. Iron deficiency technically progresses over 3 stages. In stage 1, there's a storage depletion, and this will show up as lower than expected blood ferritin levels. So ferritin is the storage form of iron, and low ferritin levels are one of the first signs that the body's iron stores are compromised. In stage 2, we're at a mild deficiency, and during this stage, transport iron, which is known as transferrin, will decrease. And this is often accompanied by a reduction in the size of the red blood cells, even though hemoglobin levels are still remaining normal. And then finally in stage 3, which is iron deficiency anemia, we see a drop in hemoglobin. And at this stage, red blood cells are fewer in number, they're smaller, and they contain less hemoglobin. Ideally, women receive adequate iron from their diet and have good iron stores. And there are 2 different forms of iron in foods that provide this iron. We have heme iron and non-heme. So heme iron we find only in animal flesh, and it has a much higher absorption as compared to non-heme iron, and therefore non-heme iron is found only in plant-based foods. Depending on other factors, about 15 to 35% of heme iron is generally absorbed compared to only 2 to 20% of non-heme. But absorption of both types of iron is increased when taken with a vitamin C rich food source. Here you can see the amount of iron in a variety of plant and animal foods, and Chef Renee will share a wider variety of iron-rich foods in her presentation. It's important to point out that some foods contain substances such as polyphenols, tannins, and oxalates that combined with iron and reduce your ability to absorb it. So these foods should be consumed separately from iron supplements and might include foods like and beverages such as tea, coffee, and also foods that contain calcium. Because of the high rate of iron deficiency, it is common for many women to rely on iron supplements to improve their iron stores. But the main issue with iron supplements is that the side effects such as nausea and cramps, gas and constipation can be so severe that women just cease taking the supplements. The GI symptoms are most likely a result of the exposure of the intestinal mucosa to free iron radicals, which causes inflammation and mitochondrial damage, as well as from changes to the microbiota composition. Iron supplements also can interfere with the absorption of other minerals such as zinc and copper. What is interesting to point out is that the amount of iron absorbed decreases substantially as the dose of iron increases, showing that iron supplementation has barriers in restoring iron status. Therefore, having a way to improve iron absorption from food and/or supplements would be ideal for the health of mom and ultimately the baby. Chef Renee will now share some more examples of iron-rich foods and ways to incorporate them into our diet. And then Dr. Koenig will discuss her research into new discoveries for improving that iron absorption.
Hi, I'm Chef Renee. Welcome to the 6th floor of the College of Applied Health Sciences. I'm in our foods lab, and this is part of the Department of Kinesiology and Nutrition. And I'm here today to talk to you about iron-rich ingredients. and I've selected a recipe that I'm going to prepare for you, and this is a recipe for a Buddha bowl. I really like this meal because it's easy to customize to your taste preferences, so it's very versatile. And I kind of use more of a recipe template rather than a strict recipe that you have to follow. So you can open the door to your refrigerator or look in your pantry and use ingredients that you already have on hand. You can hopefully avoid a trip to the grocery store and a long list with this type of cooking from a template rather than a strict recipe. You can make many different versions of this meal and utilize ingredients from almost any cuisine. We are going to focus specifically on ingredients that are high in iron, and that works very well for this recipe template format as well. I am going to make a vegetarian dish today, but you could easily add meat. Chicken liver is especially high in iron, but I didn't think too many people would be happy if I made a bowl of chicken liver, so I decided to be a little bit more creative and focus on some other ingredients that are high in iron. So we'll set the chicken liver aside for today. All right, let's go ahead and get started. Let's begin by looking at our recipe template. We have different categories and examples of things that are really good choices. So I am going to use Swiss chard in my bowl for the greens, and I chose mint and cilantro to pair with that. So I have both herbs and greens represented. You can choose 1 or 2 grains. You should have at least one source of protein. Fruits and vegetables kind of just give a fresh quality to this recipe. And the fat that you choose is really important. You're going to have a very dry dish if you don't select a good source of fat. So I really like to use avocado. Remember that fat equals flavor. So if a dish is completely fat-free, it's not going to be super flavorful, and we're kind of missing a textural element as well. So avocado is going to be my choice, as well as cashews. And then the dish needs to be finished with some type of acid, and this adds a lot of brightness to your bowl. I'm going to choose lime for mine. That might feel like an overwhelming amount of choices, so we are going to focus on iron-rich ingredients, and this is a list of some ingredients that are good sources of iron. So breakfast cereals make the list. Some of them provide 100% of the iron that you need if they are fortified. Oysters and white beans are also pretty high, giving 8 milligrams per serving. That's listed here on the left. Dark chocolate makes the list, so that's really good news. Of course, beef and chicken liver provide good sources of iron. Quinoa and Swiss chard also provide some, so I'm going to incorporate those two in my recipe. Lentils, spinach, kidney beans and tofu, sardines, chickpeas, tomatoes, beef, and most red meats in general, potatoes, and cashews are all dietary sources of iron as well. So now we know what foods provide iron, and there are 2 main forms of this dietary iron, and they're called heme and non-heme forms of iron. Heme iron has a higher bioavailability than the non-heme iron form, and this heme iron comes mainly from lean meat and seafood. So those ingredients that contain heme iron offer a source of iron that's more available for absorption. Non-heme iron foods includes things like nuts, beans, vegetables, and a variety of fortified grain products. Interestingly, vitamin C is actually known to enhance the bioavailability of these non-heme iron ingredients. So this is one really good reason to season your Buddha bowl with an acid such as lime, like I'm going to do. In addition to vitamin C, eating meat, poultry, and seafood can also enhance the absorption of non-heme iron ingredients, whereas phytates, which can be present in grains and beans, and certain polyphenols, like those that are found in cereal and legumes, really have the opposite effect. These inhibit iron absorption. So in summary, even though some plant-based foods are good sources of non-heme iron, like spinach, for example, they really have low iron bioavailability because they contain these iron absorption inhibitors like the polyphenols. But unlike other inhibitors of iron absorption, which only reduce the bioavailability of these non-heme iron ingredients, adding calcium might reduce the bioavailability of both non-heme and heme iron. But typically the Western diet is somewhat varied, so it doesn't really seem like these have a huge impact on overall iron status. But we're still not going to include any dairy in this Buddha bowl, just because we don't want to lower the absorption of iron any more than we already are with all of the plant-based foods that we are using. So even though there is competition surrounding the absorption of iron with these plant-based foods, we still want to aim to meet our iron goals by eating iron-rich foods rather than through supplements. These supplements are not very well tolerated and can produce GI discomfort and then subsequent lack of adherence to a vitamin regimen. So food first. We learned about prebiotics earlier, and I just wanted to list what foods are good sources of prebiotics. So a dietary prebiotic is an ingredient that is selectively fermented and results in specific changes in the composition or the activity of the GI microbiota. And these provide specific benefits to the health of the host. So there are 3 factors that are required for a food to be considered a prebiotic. The first is that it's able to resist digestion in the human gut. So it can resist that low pH environment of the stomach acid. It also must be fermented by microbiota. So these foods are only slightly or not at all digested in the stomach, and they end up going to the colon where they serve as food for the good bacteria in our colon. And lastly, they need to confer some type of health benefit to the host. So many of these prebiotics are fibers, but not all fibers are prebiotics. And many of them are partially digested carbohydrates like fructooligosaccharides and to a lesser degree, the galactooligosaccharides. And these carbohydrates are often referred to as resistant starches. And inulin is one of the most researched and best known. And it's found in the roots of a number of plants that we should include in our diet. These include chicory root, sunchokes, leeks, sweet potato, asparagus, onions, garlic, dandelion root, and burdock. So if you can kind of emphasize some of these prebiotic foods in your diet, that is a really good idea. We are going to use soybeans, which provide this galacto-oligosaccharide carbohydrate, and onions, both red and green, and these are good sources. These are the ingredients that I've chosen for our Buddha bowl, most of them for their high iron content. We have Swiss chard, mint, cilantro, quinoa and brown lentils, smoked tofu, white beans, those are especially high in iron, soft boiled egg, carrots, cucumbers, green onion, and shaved red onion are all going to give a nice summertime quality to this recipe. And we will finish with avocado and cashew on top. The cashew will give us a nice crunch, and we will end with a squeeze of lime and a Japanese seasoning called nori fume furikake. This has bonito flakes and miso, a little bit of seaweed. It's very savory, very delicious. If you can find this at the grocery store, I would recommend adding this. As a reminder, females ages 19 through 50 are aiming for 18 milligrams of iron per day and 27 milligrams of iron per day during pregnancy. I added all of my ingredients to a nutrition database, and it generated this nutrition fact panel for me. So you can see that this Buddha bowl offers over half of the iron that a female in the 19 to 50 year age category would. So this meal offers 10 milligrams of iron, which is pretty good. All right, let's get cooking. All right,
All right, thanks so much, Renee. Good afternoon, everyone. As Sarah mentioned, my name is Mary Dawn Koenig, and I'm an associate professor here in the College of Nursing. Throughout my career as a nurse and a midwife, I recognized that both pregnancy and birth outcomes were closely tied to nutrition status and had lasting impacts on the fetus, both in utero and later during child development. I will be speaking with you today about my research on probiotics in pregnancy and their potential efficacy for improving iron absorption and status. I work closely on the project titled ProMoms, which was funded by the Center for Health Equity Research, Share Chicago, and the National Institute on Minority Health and Health Disparities, with my colleagues, Dr. Lisa Tusing-Humphreys, a registered dietitian, nutrition scientist, and expert in iron metabolism, and Dr. Nefertiti Ojienji-Dika Hemphill, a recent graduate of the Kinesiology and Nutrition program here at UIC. Kirsten has already shared with you the importance of iron, especially during pregnancy, and has discussed the current standard of care for iron deficiency anemia. Optimizing iron status can be challenging. Currently, oral supplementation is the standard intervention for iron deficiency anemia, but barriers to body iron repletion through oral supplementation include underlying systemic inflammation from chronic conditions such as obesity, dietary factors such as phytate, and patient-reported symptoms, including gastrointestinal distress. Additionally, the current standard of care has varying effectiveness. It is not entirely clear why. However, inflammatory processes and the gut microbiota may be one responsible pathway for impeding iron absorption. Prophylactic iron supplementation is not a one-size-fits-all approach to maintain iron status. Several research groups around the globe have started to examine the importance of probiotics as a means to promote iron nutrition, largely in non-pregnant populations. Probiotics are defined as a live microorganism that, when administered in adequate amounts, confer a health benefit to the host. Probiotic bacteria are found in foods, fermented foods, which are foods fermented through a microbial process, such as yogurt and kimchi, and have also been shown to enhance dietary iron absorption. Probiotics have gained public popularity because of their possible preventative and therapeutic effects, relative low cost, and accessibility. To this end, we conducted a systematic review of the literature to comprehensively examine the existing evidence regarding the effect of probiotics on iron absorption and iron status in humans. We also conducted a meta-analysis to examine the effect of the probiotic Lactobacillus plantarum, or Lp299v, on iron absorption in humans. From our published review and meta-analysis, all 8 studies that were reported in 5 articles that examined the effect of the probiotic Lactobacillus plantarum Lp299v on iron absorption independently found a statistically significant increase in iron absorption among those ingesting the Lp299v. Overall, the probiotic Lactobacillus plantarum Lp299v significantly increased non-heme dietary iron absorption versus when iron was provided without the probiotic. It is suggested that Lp299v confers a beneficial effect on dietary non-heme iron absorption through several mechanisms, including the production of a microbial metabolite that can reduce ferric iron to a more bioavailable ferrous form, enhanced mucin production at the intestinal surface, promoting enterocyte iron uptake, and finally, immunomodulation, promoting an anti-inflammatory immune response that suppresses hepcidin, the master regulator of systemic iron homeostasis, thereby enhancing iron bioavailability. Although we know that Lp299v can increase iron absorption, we know very little of how this probiotic can impact a person's hematological and iron status, such as hemoglobin and ferritin, a measure of iron stores. Given the effects we've seen on iron absorption, Lp299v could be a good candidate to maintain and improve iron status in pregnancy. Pro-moms sought to determine if supplementation with oral Lp299v from early second trimester through delivery is feasible and demonstrates preliminary efficacy for optimizing hematological and iron status of pregnant women at risk for iron deficiency anemia. A secondary aim was to explore the preliminary effect of maternal Lp299v supplementation on neonatal cord hematological and iron status parameters. Women were randomized to an Lp299v or placebo group. Treatment was blinded to both the participant and the study staff. And starting at 15 to 20 weeks through delivery, women consumed once daily Lp299v or placebo, along with a standard prenatal vitamin with iron. The pills and vitamins were provided in a Pillsy Smart Bottle. Pillsy Smart Bottles allowed objective tracking of adherence, while also sending daily reminders to consume the supplements. Women received 32 days of pills at the baseline visit, and refills were provided monthly at their prenatal and research data collection visits. At early second trimester, mid-second trimester, and third trimester, women provided blood and completed a variety of questionnaires. At delivery, maternal blood, cord blood, delivery type, and infant characteristics, such as gestational age and sex, were collected. Lp299v Probiotic used in pro-moms is an over-the-counter commercially available nature-made product. We chose this product because this is the Lp299v formulation that was used in previous studies which showed enhanced iron absorption. Because a major focus of our study was the feasibility of this type of supplementation, it was important that we track adherence to the supplement. To do this, we used a two-factor system to track adherence. We used Pillsy Smart Bottle technology and worked with the UIH Investigational Drug Services, which provided hand counts of the returned pills. The Pillsy Smart Bottles linked to a phone application on the participant's smartphone and the online researcher platform. Once paired with the phone, the application sent a daily alert to the subject when it was time to take the supplement. Pill bottles ring and light up, and a secondary reminder is sent through the phone app. The platform also tracks the number of times the bottle is opened with a date and timestamp. This usage data was transmitted to the Pillsy HIPAA-compliant researcher interface. The average age for women in the project was 29 years, with about 3/4 identifying as Black and just under 1/4 identifying as Hispanic. Just under half being prima pares or first-time mothers, and approximately 1/3 of women were married, 1/3 were single and living with their partners, and 1/3 single and not living with their partner. 1/4 were college graduates, with nearly 3/4 earning an income less than $30,000 per year. And about half had private health insurance. We analyzed participants that completed the study with greater than or equal to 80% adherence to examine changes in maternal hematologic and iron status parameters by randomization group. In this subgroup analysis, data showed that mean baseline concentrations of hemoglobin were lowest among the Lp299v group, a trend that continued at all subsequent time points. What's important to point out here is that although the hemoglobin level was lowest at baseline in the probiotic group, by labor and delivery, the probiotic group improved from 10.9 grams per deciliter to 11.2 grams per deciliter, compared to the placebo group, which only maintained their hemoglobin level throughout labor and delivery. Similar to hemoglobin, the probiotic group's hematocrit level at baseline was lower than the placebo group's hematocrit level. And we saw a slight rise in hematocrit among the probiotic group, whereas in the placebo group, we saw a decline throughout the pregnancy. Again, circulating serum iron was lower in the probiotic group at baseline and improved during the second and third trimesters when iron demand of the fetus are at their highest. Whereas in the placebo group, we saw a decline in serum iron. Serum circulating ferritin was lower in the probiotic group at baseline compared to the placebo group. The change from baseline was lower in the placebo group for both the 24 to 28 week and 34 to 36 week gestational time point. Therefore, although there was a decrease in the probiotic group in iron stores from baseline to delivery, the rate of decrease during the mid-gestation and later gestation when infant iron needs are at their greatest was not as rapid as in the placebo group. We also attended the birth and collected cord blood as a proxy to neonatal iron status. We worked very closely with the labor and delivery nurses and staff and coordinated an electronic alert system with the UIH technology services, so that when one of our participants were admitted to the labor and delivery unit, the nurses on the unit were alerted to the patient's enrollment in the study and informed them of our study contact information. The labor and delivery nurses were diligent by calling us when a participant was admitted. Additionally, we remotely monitored the labor and delivery unit daily for participant admissions and maintained a close relationship with our participants throughout the project. In fact, many participants called us as they were heading to the hospital. We monitored participants' progress through the electronic medical record and attended the birth, collecting cord blood at delivery. We extended our evaluation of the effects of the maternal supplementation to the neonate. The neonatal hematologic and iron status parameters were examined for the newborns of mothers with greater than or equal 80% adherence. Lower cord hemoglobin and hematocrit was observed among neonates from the Lp299v group. However, neonates born to mothers in the probiotic group had higher cord serum iron and slightly higher cord serum ferritin. Lp299v supplementation in pregnant women with low iron stores was well tolerated and displayed a promising increased trend on maternal and neonatal iron-related hematological parameters and iron status. Again, this is a pilot study, and so that should be kept in mind as we're interpreting the data and thinking about the data. But next steps should include the investigation of Lp299v in a larger diverse sample population, randomized on potential differences in early gestational hemoglobin and systemic inflammation, and additionally, objective measures of stool enrichment of the probiotic, as well as supplemental effects on maternal placental fetal iron trafficking using a safe, stable iron isotope should be included. And finally, extending the assessment of the offspring to later time points in infancy and early childhood would be an important future endeavor. I'd like to thank my research subjects who devoted an enormous amount of their time and energy toward this project, my collaborators, Dr. Lisa Tusing-Humphreys and Nefertiti OGNG Dika Hemphill. I would also like to acknowledge and thank both the Center for Health Equity Research, Share Chicago, and the National Institute on Minority Health and Health Disparities. And now Renee will conduct a cooking demonstration incorporating iron-rich foods from the UIC Nutrition Teaching Garden to create a bootable for you and your family.
All right, before we begin cooking, we need to harvest some ingredients. So I came down to the UIC Nutrition Teaching Garden in order to do that. This area is an outdoor classroom space that serves the students who take our cooking classes here in the Department of Kinesiology and Nutrition. And it also serves local food pantries in our community. We donate produce on a weekly basis during the summer to food pantries that surround UIC. So in this space, students learn about soil health. In addition to how to grow plants and harvest them, they set aside their food waste that they generate during the cooking process that happens right upstairs in our foods lab. So we compost this food waste and it benefits our garden tremendously. And we have worms, we have a vermicompost bin that further help break down this food waste or these kitchen scraps and turn them into garden soil. So this action supports the life of new plants during the next growing season, and the cycle continues over and over again. So I'm down here to harvest Swiss chard, red and green onions, cucumbers, mint, and cilantro. So let's go ahead and do that. Swiss chard is really easy to harvest. All you do is snip it with scissors, like this. All right, we are finally ready to start cooking. I have all of my mise en place laid out on this tray. Mise en place just means everything in its place. So I've gathered all of my ingredients. I make sure that I have everything that I need to complete this recipe. And I've set up my station with my chef's knife. I have a cutting board that's not slipping around. I have a compost bin here and some other tools that I know I'm going to use. So I like to get myself set up so that I can just start cooking. For this recipe, I know that our grains are probably going to take the longest to cook because everything else is pretty much just a matter of slicing up. So I'm going to cook the quinoa and the lentils because those have the longest cooking time. So let's go ahead and begin with that. Let's begin with our brown lentils. So I have 1 cup measured here, and I'm just going to rinse them in cold water first to rinse off some of the extra starch. All right, and I've removed the starch. I'm going to go ahead and put them in the pot. The ratio for water to lentils is 3 cups of water to 1 cup of brown lentils. So I'm going to use cold water. I'm going to cover it with the lid slightly ajar, and I'm just going to set it on the back burner over here and turn the flame up to about medium. And we'll just let it boil, and lentils actually cook quicker than I think most people think. These are probably going to be done in 10 to 15 minutes. Brown lentils are a little bit smaller, so I like to check on them sooner than later, but I'm going to watch for them to boil. All right, in my other pot, I'm going to cook our quinoa. And what I like to do with quinoa, I actually had a student that taught me this trick and I love it. So I have 1 cup of quinoa measured, and the ratio of water to quinoa is 2 cups of water to 1 cup of the grain. But I'm actually going to use boiling water because I think it helps make the quinoa a little bit more fluffy. So thanks to that student who pointed that out to me. I love that. So I have some boiling water over here, and I'm just going to measure 2 cups. And again, I'm just going to set that lid ajar and turn my flame up to about medium heat. At this point, we just need to prep the rest of our ingredients. So I have peanuts, I've already chopped these. I have a smoked tofu, which I just quickly diced into cubes. Very delicious, very savory. The white beans, I didn't need to cook these at all. I just opened a can, rinsed and drained them. So those are easy prep. But the items that I do have that I need to do a little bit with is this boiled egg. So I'm gonna go ahead and peel that. All right, let's go ahead and chop up our greens. So what I like to do with the Swiss chard is I like to chiffonade it. And chiffonade just means that you are kind of laying the leaves on top of one another and you're rolling them up in this fashion. And then you're kind of doing a nice quick thin slice. Swiss chard, it is pretty high in iron, like we said before, but it can be kind of fibrous, and I don't know, some people might think it has a bitter quality to it, so I think keeping it in small pieces makes it a little bit more appetizing and palatable to the eater, and you might be able to get some kids to eat this if it's in smaller pieces rather than large. So we'll do a chiffonade. I also have this handy tool over here that kind of helps me pick up whatever is on my cutting board. This is called a bench scraper, and it's just kind of a pro tool that the chefs like to keep on their station. And I want to use a nice rocking motion for my knife. Notice how I'm holding the knife. I'm not holding it like this. I'm actually kind of choking up on the knife and gripping it a little bit higher. This is the most comfortable, so I have 2 fingers kind of on the blade and then my other 3 fingers wrapped around. And I'm just doing a nice rocking motion like this. And that's really the most efficient way to cut. So if you start practicing that way, if you don't already do that, it's a good skill to have. Next we can do the carrots. I'm not gonna peel these carrots. The peel actually has a lot of good fiber. The antioxidants sit closer to the peel, and these are pretty young and tender, so I don't think it's really necessary to peel them. I'm just gonna slice them on the bias. Green onions are next. All right, so this is a red onion taken straight from the garden. I'm gonna show you how to julienne this. So I'm going to take the top and the bottom off, and I'm just gonna take a couple of these outer layers off of the onion. All good for the compost. Remember, onions are a good source of inulin. So I'm slicing from the top down to the bottom where the root was, and I'm just going to lay it on this nice flat side. You always want to have the flat part of your vegetable on the cutting board, just so it doesn't slide around. And I'm kind of tilting my knife at an angle, and I'm using that nice rocking motion to slice all the way through my onion. And so juliennes look like a half moon shape. Okay, so you don't want to chop this way. This is not a julienne. You're going to chop so that the segments kind of stay together and look like half of a moon. I also have some mint. I'm just going to pick this from its stem. And for mint, we could do a chiffonade. I'm actually going to just leave it whole and kind of tear it right before I put it on my dish. After thinking about this a little bit more, I'm actually not very excited about this quinoa. It's just kind of bland and boring, so I'm going to season it with a little bit of salt. I'm using a kosher salt here, but I'm going to add some lime zest and pepper just to kind of spice this up a little bit. So I have a microplane, and I'm just going to take this zest off. Normally this would just get thrown away, so this is a really good use for it. And this is going to give some more brightness and pizzazz to my dish. It's always so important to taste and adjust seasoning as you go, because sometimes ingredients on the recipe are different than what you buy in the grocery store. So you really have to use your senses and pay attention to the cues that your food gives you in order to make your food taste its best. So tasting and seasoning as you go is the #1 rule in the kitchen. All right, it's finally time to build our Buddha bowl. So I'm going to start with putting the grains in this bowl. I'm using half a cup here of quinoa. You don't have to measure it perfectly, but I'm going to for this. I'm gonna do my lentils on this side. over here. And I'm just going to kind of distribute the beans. Next, add my vegetables. Carrots, cucumbers, oh, delicious, so fresh. I'll tuck my tofu in here. And then I'm just gonna finish with my onions and herbs. A few green onions here. And throw a couple jalapenos on. For the mint, I'm just gonna tear this just to hopefully not bruise it too much, but I'm doing this right before I serve the dish. A little cilantro as well, always looks nice, especially these really beautiful flowers. Certainly very edible. Cashews are gonna give the dish some nice crunch. I'm just gonna slice this egg in half right here. And we'll do a little bit of black sesame. I kind of like the color contrast here, so I like to use the black sesame for that. And it's finally time to slice our avocado. So the way I do this is I just go around this pit that I know is inside. It looks like that. And I'm gonna leave the pit side and just squeeze a little bit of lime on it. And I'm gonna cover this really tightly with plastic directly on the surface here and put it in my refrigerator for another use. This is going to help prevent it from turning brown from oxidation. And then to finish the avocado, I just kind of hold it in my hand and very carefully I use the point of my knife and just make these nice thin slices. A beautiful avocado. And just make sure you don't puncture through the skin or else you will hit your hand. And then I just take a spoon and I kind of scoop it out like this. Just make my way around. This one could maybe be a little bit riper. And this can be composted as long as it doesn't have a plastic sticker on it. And then I'll just kind of fan the avocado out like this. All right, and then don't forget the lime juice and the furikake seasonings. All right, this is our dish. I can't wait to eat this iron-rich bootable. And that is how we make a bootable in under 30 minutes. If you have these grains prepped ahead of time, that is going to make your meal prep process so much quicker. You can cook quinoa and lentils and rice and things like that and keep them in your fridge for up to a week. It's easy food prep. So I hope that you will try making this recipe at home and make your own version of it. Try to include foods that are really high in iron, and hopefully this is an easy, simple weeknight meal that you can just put together on the fly and enjoy with your family. Thanks for joining us.
All right, well, thank you so much, Kirsten, Mary, Dawn. Oops, one moment, let me close that. Sorry about that. Can everybody hear me? Okay, the next video started playing. So thanks again, Kirsten, Mary, Dawn, and Renee. It's been so interesting, and I think we're probably all now ready to eat a delicious bootable. But first we have time for a few questions. So as Sarah shared earlier, the chat function is open if you have questions, so feel free to type them there. And we did receive a few while the presentation was going on. So I'm going to jump right into those. And then whichever presenter would like to field the question, please unmute yourself and feel free. So question number one is, do B12 and iron deficiencies go hand in hand?
Talk about this one. So not necessarily. Iron deficiencies both obviously will result in anemia. So iron deficiencies usually result in what we call microcytic anemia. B12 deficiency and a folate deficiency result in a macrocytic anemia. And B12 deficiencies can be from a variety of factors. If somebody is following a completely plant-based diet, vitamin B12 is only found in animal food. So there are ways around that. You can certainly take fortified foods. You could do like a brewer's yeast is another way to add B12. And also there is B12 relies on something called intrinsic factor to be absorbed in our stomach. So if we have low amounts of intrinsic factor, so we could have adequate amounts in our diet, but if we have low amounts of the intrinsic factor, which can happen from overuse of antacids, for example, or just as we age, that also can result in vitamin B12 deficiencies. So they are different. They're different types of anemias, but as you mentioned, they both can result in anemia.
All right, thank you. Question 2. Any thoughts on those allergic to avocado? So I guess a substitute for avocado.
Yeah, I really like cooking from a template rather than a strict recipe, because I think it really allows you to customize the meal you're making to your dietary preferences or allergies or whatever. Coconut, raw coconut that has not been sweetened, it has a similar texture. It has, it's kind of a source of plant-based fats. So you could certainly do that. I would say fresh coconut is probably closer to avocado than a dried one would be. Also, I think I saw the question of how can you make this a little bit, or you can make this meal on a budget. And I would say the way to do that, and the same with substituting for avocado, is to kind of open your pantry and see what you already have that fits into these categories. And so, the source of fat you choose doesn't have to be avocado. It could be an oil, it could be a nut or a seed, something like that. You could do a sauce to give it a little bit more richness too, that maybe you have on hand. So this is very versatile. And I think if you have a garden, eat what's in season, eat what's growing in the garden, and tailor the recipe for that.
Yeah, and we'll share the link to the video that Renee put together. So there's almost that kind of chart that gives some different foods for consideration in different categories. So I think that'll be helpful. So you already answered question 3. Thank you. Question 4 is, are the recommended iron intakes really sufficient?
I can respond to that one. If Mary Dawn, if you want to hop in after as well. Yes, the RDAs are sufficient. The issues is more on the absorption side of things. Iron, as we've both kind of addressed, is very pro-oxidative. So increasing free iron is not always a good thing. So the RDA is good, but it's just the absorption that is the problem.
Yeah, thanks, Kirsten. And just to add to that, is that sometimes there's underlying conditions that can impede that absorption. So it's been shown in the literature that chronic conditions such as obesity has a systemic inflammatory response, and that inflammatory response actually prevents iron from exiting the cell and being bioavailable, being utilized within the system. And so that's really the root cause of the problem in cases where there's other conditions impacting the availability. And so pumping somebody full of more iron is not the solution in that case. In fact, as Kirsten alluded to, it can cause oxidative stress, and it can have deleterious effects on the microbiota. So we have to be very careful when thinking about iron deficiency and classifying individuals into categories of whether they're actually suffering from true iron deficiency, whether this iron deficiency is coming from a true depletion of iron from the diet or supplement sources, or whether the iron deficiency is coming from another source, such as chronic inflammation. And so that getting to that root cause and addressing the root cause should be the primary intervention when working with patients with IDA.
Thank you. And we're getting some great questions. So the next question is, do those with nightshade allergies need to avoid potato starch-based probiotics? For example, the Nature Made product that the photo was included of apparently has potato starch base.
Yes, I guess if you have an allergy to potato starch, then you wouldn't want to take that product. So it's important to kind of look at what's inside the product. Unfortunately, a lot of supplements in a pill form have starch, potato starch in their product, but there are other ways to get Lp299v. There's a Good Belly product, which is sold, it's a juice, and the Lp299v is within the juice. And so that product is called Good Belly, and it's available in your grocery store. That's one that I'm aware of. I'm not sure if there's others out there, but you could certainly Google and look for alternative ways to administer the product.
All right. The next question is, how impactful is calcium on absorption of iron? And I know this was touched on briefly, but this person's asking, for example, if you eat an iron fortified cereal with milk, or you take an iron supplement with calcium fortified orange juice.
Yeah, great question, Lorelei. Lorelai's one of our former alumni students. So I don't know the exact statistic on it, and I'm sure that can be affected by other foods that you might be consuming. But what I would say the best kind of best practices for taking iron is ideally on an empty stomach if the person, your client, can tolerate that. And then if somebody is, and to take it outside, I would definitely take it separate from any other types of potential minerals like calcium, zinc, copper sources. And then the other best practice is if somebody is having GI issues, it has been shown that if they take supplements every other day, that it is pretty similar in terms of the impact on iron levels, in increasing iron levels, but sometimes makes it much easier to tolerate. So those are just some other best practices, but I would say that it would be a good idea to not take an iron supplement with one of the calcium rich foods that you mentioned.
All right. If you diagnose someone with mild iron deficient anemia, how often are you checking labs, and what labs do you do?
So typically in pregnancy, they check for iron deficiency anemia at that first visit. And it's typically done through a CBC, which is a hemoglobin hematocrit evaluation. And then you can also see, MCV and some other indices that might give you an idea of what type of iron deficiency anemia they are suffering from. But what part of my research kind of questions the limitation of the CBC as an only marker, because as Kirsten mentioned in her presentation, we've got lots of dynamic things happening, and iron deficiency anemia is essentially defined as, during that stage 3, when we get down and we've got a depletion of and we're seeing it in the hemoglobin. And so for me, and what I think should be happening, especially in pregnancy, and to really get people into categories of which iron deficiency that you're suffering from, is to have an iron panel. So that would include having a ferritin level, which is a marker of iron stores. There would be some other like transferrin, serum transferrin receptor. These are markers of how iron is being processed and moved around in the body. And in addition, I advocate for looking at CRP and potentially IL-6, because I think that this would give an idea of whether an individual is having increased inflammation. And again, hepcidin, which is a master regulator of iron in the system, looking at whether these hepcidin values are elevated along with the inflammatory processes, because I think then that would give practitioners a more clear understanding of how to approach the iron deficiency in the individual and what kind of therapies that they should be using. So for example, if an individual has a systemic inflammatory process happening, that applying an iron, either a supplement, an oral supplement, or doing an IV transfusion of iron would not be an appropriate intervention for that individual. So if an individual is checked in that first trimester and it comes back as low, then usually practitioners will check again sometime in the second and maybe again in the third trimester, just to keep an eye on it. To see whether it's progressing. But in my opinion, that's not enough. I think that individuals, our current project right now, we're looking at another product called lactoferrin, and we're monitoring these women monthly to see how the change happens throughout the trimester and to keep an eye on the iron status throughout the pregnancy. This is critical. We need iron during the development of the fetus for neurocognitive development. We're seeing long-term irreversible neurocognitive defects in children who have been born to mothers with low iron. And so I think that it needs to be monitored much more frequently than what we're doing. But to answer your question, typically first trimester, and then probably another follow-up later in the pregnancy.
So Mary Dawn, I think you were kind of hinting at what this next question is asking perhaps. So what are your thoughts on iron infusions and when are they appropriate in pregnancy?
Yeah, they're appropriate for sure. You know, of course, the first line of defense right now, the standard of care is oral iron supplementation. But if we're seeing iron levels, and I've seen this in both my research and practice, we see iron levels going down into the 7s, 6s in some cases. So absolutely, an iron infusion is absolutely appropriate in those cases. It's probably not appropriate in a situation where maybe you have a 10 or 11. Of course, that's not, you know, we're on the cusp, and we should be watching and doing some interventions, but an infusion at that point is not. So it's patient dependent on what's happening.
Okay. So our next question is a little bit more general, but I think would certainly affect pregnant women. So as far as organic versus conventional produce, are nutritional values of organic food higher, or is there evidence that organic should be favored over conventional when we're thinking about nutritional values? I don't know.
I can't answer this one. This is definitely hotly debated. As far as the literature that I've read, I haven't really seen good evidence that the nutrition values specifically differ in organic versus conventional. However, I do think that how the farm manages the soil plays a huge role in the flavor of the produce. And I do think it's possible that someone out there is doing research on if that it impacts nutritional value. I have not found those. I haven't read about those. So if anybody has, send them to me. But I do think that we want to eat really flavorful food. But I also don't know that having certified organic produce that is, much more costly is something that we need to be telling, a patient population that just doesn't have the resources for that. I don't think it's helpful to tell them that they're not eating as well, because they can't do organics. And so in our garden, I use organic growing methods, but we're certainly not certified organic. This is kind of a a legal stamp on produce. And if the growing methods are better, I think it's great to support those farmers. And if they're really caring for the soil and the environment, great. But I don't think that there's a reason to shun farmers who are not certified organic. That's a really expensive certification, and it's not viable for many of the farmers. Yeah, those are my thoughts. Kirsten, I don't know, maybe do you have anything else you want to add to that?
No, I agree everything with what you said. And I usually say that the conversation about organic and versus conventional is really more of an environmental conversation versus a nutritional conversation.
But we can also go a step above to regenerative agriculture, which may or may not have, you know, that organic seal. And those are really, I think, the farmers that are most environmentally concerned. And I would want to support those, you know, at your local farmers market or you know, whatever, in whatever way you can, over purchasing organic. But if you can't do either of those, still eat produce. I mean, that is the best option. Fiber rich produce.
We certainly made it look very appealing, all the colors and the textures and everything. So I encourage people to continue. If you have additional questions, I think I've run through the ones we received in the chat, but we still have some time left. And we did have a few questions submitted in advance, so I'm going to head to those now. So the first question is for Mary Dawn. What challenges did you encounter with conducting the trial during COVID-19, and how did you overcome those challenges?
Yes, when we were conducting the trial, it was kind of right in the middle of COVID, and there was a full hard stop directive that came down from the university. And so we did have to pivot quite a bit because a lot of our interactions with the patients were face-to-face. You know, getting the supplements to the patients, we did that directly face-to-face. And so we had to work with the pharmacy to find alternatives. And so one of the alternatives with getting the supplements to the patients were to send them directly to their house through a mail system. And then to do the hand counts over Zoom with the patient, showing us the pills. So that was one of the ways that we pivoted. And then another piece was getting that blood draw. And again, because we had a full stop directive from the university to stop research face-to-face interactions, at least, we had to figure out other ways around getting the blood draw. So we coordinated with the phlebotomy lab on the 4th floor of the outpatient center, and they would draw extra blood for us for our project, and then we would go pick it up at a later time. We conducted a lot of the surveys through Zoom, so that type of follow-up. And then our labor and delivery was affected. The collection at the labor and delivery, when it happened, it was really unfortunate because when we got the directive from the university, we had a patient go into labor, I think it was a day or two later after that came down. So we didn't actually go to the hospital for that delivery. But afterward, we kind of thought through how to do this. And so we would go into the hospital and go into a room that was separate from where the patient was delivering and wait for the delivery, and then simply collect the cord blood and placenta tissue, not so that we weren't face-to-face or in the room with the patient, but in another room. And so we coordinated that with the staff at the hospital, and they were very generous to work with us. So there was some pieces we had to pivot around, but we made it work.
Yeah, it's great you were able to complete the study. I know so many things were interrupted. So, okay, so the next question is, how would you implement this research and recommendations with patients or with clients?
Yeah, I can answer that one. You know, I think what is really unique and interesting about the three of us presenting is because you're really seeing the research and then how that is translating into recommendations, and then more specifically even how to actually implement the foods that we would recommend, not just with the overall recommendations. And so so I have actually been working with a client who had a history of diverticulitis, had been on a lot of antibiotics because of that, and her iron stores have just been really low. Her hemoglobin has been dropping. She's had all the tests done to rule out anything that medically was going on. Everything was negative. And so I started working with her and suggesting the probiotic that was used in the research. And then, of course, also the foods like Renee talked about that not only are rich in our heme and non-heme iron, but also that help to support the bacteria, so the prebiotics. And I also suspected that she might have a little bit of gluten intolerance, which is affecting the health of her large intestine, her gut. And so she, we started this probably 6 or 7 weeks ago, and she started feeling better right away. Her energy levels, it's going to take time to see a jump in her hemoglobin and iron stores, but so far it's moving in the positive direction. So it was exciting to be able to start to kind of implement these ideas right away. And even though this is somewhat preliminary research, it's all good. We know that bacteria, the probiotics and the foods that we're recommending are nothing but beneficial for us. And so it was something that we just wanted to start and try right away. So yeah, we'll kind of stay tuned with that.
Great. So it's good to see that in the application, just not the hard facts. So here's a bit of a lighter question. As relates to the Buddha bowl, what other seasonings or sauces could you use to maybe make it a little more flavorful?
So in this particular one, I like to keep hoisin sauce in my pantry. So that would be one that I would use. You could also add something spicy, like a sriracha or sambal olik or something like that. But if you're just kind of using this general template, I always think of the sauces or, the seasoning at the end, usually coming from acid and fat. So that could be things like salsa, lemon, lime, and it's not just the juice. So if you buy a lime at the grocery store or a lemon, don't just juice it. Like before you juice it, take that zest off and throw that into your dish too. I always try to stress with my students, use the whole plant or the whole animal in any way that you can, so that we don't throw it away. I think if this went in a Tex-Mex direction, kind of like I think salsa or tomatoes could even be used. And then too, don't underestimate the power of herbs. If you are, growing an herb garden on your windowsill, or even if you have dried herbs, throw those into instead of salt and pepper. Salt and pepper certainly have their place in cooking. It's not at the dinner table. It's during the cooking process. And then use herbs to kind of flavor your food rather than throwing salt and pepper on, at the table. I think that's probably how I would approach that. The herbs really pack a powerful punch.
Okay, now I'm really hungry. And Caitlin's recommending Whole Foods line of sauces. So I think those might be a little less expensive than some of the brand names. So we just received one more question. This person is saying, in my practice, patients with very low incomes and limited SNAP dollars, organic food, both fresh and non-fresh, did not make the cut. Fresh/garden veggies are less available and or costly. So how could we figure out how to adapt the gorgeous bowl of food to less fresh ingredients?
That's a good question. I think maybe you can pick 1 or 2 fresh ingredients, like the greens, and then really emphasize those grains, whether it's lentils or rice. If there's some kind of inexpensive nut like peanuts that can sit in your pantry shelf, that would be a really good option. You know, like I said earlier, I really don't think, especially if you're on a budget, it's probably not worth your dollars to spend them on, you know, organic produce. I think that's hard. And then two, I would say eat within the seasons. I know that fresh produce is expensive, but things are often on sale when they're in season. So kind of figuring out what is growing at this time and what's available and shopping the sales, I think is a good way to avoid overspending on some of that really pricey produce. And there's nothing wrong with Aldi's. Like, you do not have to shop at Whole Foods. Aldi's has quite inexpensive produce, and I'm pretty sure that they accept SNAP funds. So also too, food pantries in the summer. I know that there are, our garden personally donates to food pantries around UIC, and I think, you know, take advantage of it. And if you see a weird vegetable that they have, like, try it out. Yeah, don't be afraid of it. It can probably fit in a Buddha bowl.
Also, just to add on to what Renee said, I actually just did in one of my classes, we built some sample meal plans around the Thrifty Food Plan for a family of 4. And using the plant-based products that Renee used, like the beans and the lentils, they're so much less expensive than meat. And so that is, especially if you're buying them dried, like, no, thanks. Sorry, is going to be really, like, those plant-based sources of proteins are much less expensive. And even beans, you could do dried beans, and I mean, canned beans are pretty inexpensive, but Aldi had them on sale for like $1, I think. So I would probably say if I was going to pull out a few things of the recipe, maybe the fresh herbs, those might be more expensive. But again, if you have some on your windowsill to grow, avocados sometimes are more expensive as well. But really, most of the things in that were in the Buddha bowl would definitely fit on that Thrifty Food Plan.
Yeah, and I would encourage them just to, you know, use the template. Don't get bogged down by having to follow a recipe specifically. If you can have a source of acid, fat, and you know, all of those categories, like, you're doing great. You know, it doesn't have to be like some fancy expensive grain like quinoa. You know, brown rice is fine. It maybe isn't as trendy, but it's fine. It's delicious and very nutrient dense and has fiber.
Excellent. That's super helpful. I think we'll really be able to apply this after today. So I want to thank again our presenters for being here, and thanks to all of you who attended. We hope you enjoyed the event, and as we shared, we'll be sharing a recording and a separate YouTube link to the complete video. So you'll be able to go back and maybe cook along with Chef Renee. So we hope you all enjoyed yourselves, and we hope to see you at future events. And we have a slide here that highlights some of our upcoming events and also where to find out about any future events. And it's because this is a joint event, we have 2 separate links, but we also want to point out the Nursing All Alumni Reunion is going to take place on October 16th. So if you haven't registered for that, please do so. And then our annual celebration for AHS alumni, which is aptly named AHS Celebrates, that will be taking place virtually this year on November 4th, and registration is open for that as well. So full information on both of those events are on the links that are provided there on the slide, and I'll go ahead and pop those in the chat as well, so you can easily link to those. But thanks again to everybody for attending, and we hope you check out the video, and we hope to see you again soon.